what does well-being mean to you as a healthcare specialist?
Well, thank you, Dr. Webb, for this question. And well, first of all, I just want to say thank you for inviting for this honorable conversation with you. It's a true honor to speak to my alma mater, where I come from. In preparation for this meeting, I kind of like pointed out a couple of key points that I would like to say that well-being means to me. It's first of all, be good to myself, be on a good terms with yourself. Before you go to bed, always kind of like go back and see, did I hurt someone?
Mm-hmm.
How did it go? How can I do it better? And at the end, praise yourself. Praise for what you've done. And be positive. At work, especially in nursing, patient can yell at you. Family want to fire you for this reason. But look at this, not just because you did something wrong or I did something wrong. It's just a sickness and just an illness in a situation. And always think about it as a great opportunity for experiencing this moment and learn from this. So always look at this as a good thing. So be positive. It's also a part of my well-being.
Well, this is interesting to me because, you see a lot of people who aren't at their best. How do you translate what you've just said to me to them? Because I like what you said. And is that part of what you learned as being a nurse, or is that just part of who you are?
A good point. I think the part of this come from the family and the values, the books, the colleague come later in life, but what your parents taught you, what your grandma taught you, going to stay in as the fundamentals of your future, who you are. And the big deal in my profession was just to work with people and realize their vulnerability and understand that they are coming to us in ICU in a very bad moment. They're not themselves.
Mm-hmm.
They cannot control what's going on. And you need to be present. You need to show the authority. You just need to be there for listening and support. And then you learn how to read this moment and you interject and show them that you are in a supportive way. You're there. In our huddles for nights or days, we incorporated the communication is a big deal, and that helps our nurses too.
Mm-hmm. So now this is interesting because I'm going to ask you, what advice would you give to some of our students who are in a learning mode about what you've just said? Because I like that idea. What would you say to students who are coming into the hospital or coming into a clinic for the first time, and they're seeing these people at what I would consider some people to be at their worst?
Yeah. Don't be afraid. Don't be scared. You chose the wonderful profession, the best profession in the world. You're here to care. And if you genuinely have this feeling inside of you, the patient will feel that you have this feeling, and they will listen to what you're doing. I recall my first time being a nurse at we have a clinical practical in Northridge Hospital. And I supposed to start an IV. And I remember my clinical instructor said, never tell patient that it's your first time. Don't tell them that this is your first time. They will never agree, whatnot.
That's right.
And what I did say is I found the connection with one patient. And I told him about my assignment for today. And I asked for permission. I said, please forgive me, but may I ask for the permission? I did several clinical trials in Northridge settings, but I didn't really practice on a real patient before. Will you allow me to start an IV with you? He looked at me and he allowed me to start the IV, and it was successful. And he said it was good. But I think this development of being honest, being trust, not to be fearful, and you go for it. Definitely work with your preceptor, because they will assure he will help you which patient is good. But
it would appear to me
be present.
Yeah, that's a great message to send to students. Be present, be aware, be honest. But being honest with people doesn't mean you have to tell them everything, because you don't want to induce fear, which is what your preceptor was saying. You don't want to make people afraid. But I like the fact that you eventually went in and said to the person, listen, this is part of what I'm supposed to be learning to do. I know how to do it. Will you trust me to take care of you? And I think it's the way you behaved and the way you said that person said, okay, fine. Many times from people, like when I go to hospitals and stuff, there will be young physicians and young nurses who are training, and the senior person will always introduce me to those people and say, I'm going to ask them to do this. I'm going to be supervising it if that's okay with you. And I never refuse, because how else are you going to learn? I mean, this is a hands-on profession. You've got to
Exactly.
do it to make it work.
Exactly. Yeah. Yeah,
So
it's a
now,
part of professional courtesy too. We gotta teach each other, we gotta learn, and patients appreciate it. They feel like they're inclusive, and it's not somebody whispering behind their back. They're right there,
exactly.
and this is a moment even to ask questions.
So I want to ask a question to you about being a nurse. How do nurses learn how to be so open and caring with the patients? So, like, especially if people have been in a hospital for a few days, because the nurse will come in and they put their name on the board. They'll go up to the person and say, I'm Brenda,
Uh-oh.
I'm John, I'm so and so, I'm
No.
your nurse. So how do you guys do that?
Well, what I do as a CNS in a hospital, we do onboarding. And my onboarding starts with an empathy and sympathy session by Irene Brown. And
Oh,
I think it's important to have an exercise empathy and exercise sympathy, and make a big differentiation about that. And then we'll go case scenarios. How do you practice empathy? And we do this practice before watching the video and after. So people will come to realization that, there is a way, this is an art to practice empathy. And how do we empathy? If you don't know how to practice empathy with yourself, with your colleagues, how can you do it with your patients? So that's a big first hour of onboarding. It's basically practice basic communication skills and understanding excellence of human caring. So what is entailed too? And only then we go to the technical stuff with human dynamics and SWANs and stuff like that. But human being is number one. Something that I learned from Dr. Heifel's lecture, that is important to do research constantly and see what is out there, what techniques are available. And in one of the articles I was reviewing, I believe it was Sweden. Basically, if you would like to be a nurse, you need to go to the hospital rotation. And the first rotation is actually evaluation of your human skills. Do you have empathy? Do you have caring? And if you don't pass those skills with the preceptor, you're not allowed to proceed with the program. So that's kind of interesting.
Yes, that's actually very different. Well, I think part of that interview process is what they probably are looking for when they interview students for entering into these programs. That's why grades are not always the ultimate point. Because they look at the overall person. Because I remember when I was at the clinical side, we used to have students who were wonderful on paper, and we'd interview them. And it's like, geez, I couldn't put this person in front of another human being. They don't show enough care. They're not very respectful, and you can't have that. And I think that's the case, because even when you're tired, even when you're exhausted, even when you're beat, you still show up for that person, which is one of the things I love about your profession, is that nurses just care. And they do it naturally. And it's an important feat. So I'm going to ask you, I guess this was the final question, is what advice do you have for our students today? For those who are thinking about being nurses, those who are in an A-BSN program right now, about to become nurses, those are in the other students who are in our other cohorts, what advice do you have for them, especially as a training nurse?
Dr. Webb, thank you for this question. I was thinking, how can I put it in short? But number one, Guys, you're in a great profession. You can be a bedside nurse, you can be a nurse researcher, you can be a nurse scientist, you can become advanced practice nurse, you can be a clinical nurse specialist as me, or you can decide to be a nurse practitioner. You can be a clinical instructor and give back to the community. You have all variety of sessions. And the other trick you have, once you have this nursing strong knowledge, you don't really go to the doctor that much. You'll have more friends who will be checking in with you, and your kids and your family members, got to get a great care because they know that you're a nurse. Number two, I strongly encourage everyone to look out for artificial intelligence and look about the robots that have been very, very much developed and being humanized, and look and act as human. We have Robot Sophia, you're going to check it out. I would like to remind people that human skills are number one thing that differentiate us between the machine. Even maybe the financial leaders would like to have somebody who is like Robot Sophia, will be taking care and, giving meds and drugs and turn the patient or whatnot. But there's something that will never replace. It's human caring. And human caring with the nursing knowledge and understanding how it works, it will never be replaced. It might be in some kind of a cases that you will be overseeing robots. You'll be the one who will make decisions. But please study nursing with your heart. Learn how to be a good human, and always look at people as they are your family members. It's not it's a crazy patient, this and that. No, that crazy patient, because of some kind of like sickness that's going on, and you and people can make them better. I also I put it out here, if we are stressed, and you guys all stressed before NCLEX, and, you will pass NCLEX. If I pass NCLEX, you guys will. I had all questions on my NCLEX. I passed. Oh, good. Stressed, if you look in backwards, it says desserts. So it's not really stress, it's all desserts. And look positive. People are hiring. I'm a president of ACN San Fernando Valley chapter, so join our chapter. It's a great network with all the leaders of the San Fernando Valley and Ventura and Los Angeles leaders. They are hiring. It's always good to connect early once you're a student, and we'll get you connected to all the new grad programs. We need you. Please come to us.
What a great answer. Good. Thank you. That is fantastic. Yeah. What a way for us to end. I have loved talking to you. I love the advice. I love your joie de vivre. The whole sense of, and I can really feel from you, like how much you care about what you do, and and I know your patients must care. They must know it too. It's something that you can't hide. And guys, thank you so much. You are a wonderful ambassador for CSUN. And I want the students who are watching this to know this is what we want from you. To go out and become a person who cares about the community, for whom the community matters, and at the same time, the person has a personality and a wonderful way about themselves that makes us all care about them as much as they care about others. Thank you so much. I really have enjoyed talking to you. This has been fun.
Yeah.